Welcome to our discussion today. I'm Dr. Keiro, JM, consultant obstetrician and gynecologist working with Westlands Medical Center. There is a common problem that women have during menstruation. It is called menorrhagia. Menorrhagia simply means heavy menstrual bleeding. Heavy menstrual bleeding should be checked to verify that there is nothing serious. At some point in a woman's life, she is likely to suffer from heavy menstrual bleeding. Heavy bleeding can be defined as excessive, prolonged, or both. The symptoms and signs of menorrhagia may include the following: menstrual flow that soaks through one or more pads or tampons in 1 hour or less for several hours consecutively. The need to use a pad and tampon or 2 pads to adequately control menstrual flow. The need to get up and change a pad or tampon during the night. Menstrual flow lasting longer than 7 days. Menstrual flow that includes large blood clots. Heavy menstrual flow that interferes with your regular lifestyle. And the 7th symptom is anemia, which presents with tiredness, shortness of breath, and sometimes palpitations. If any of the above signs or symptoms is affecting you, it is important to see your gynecologist. It is also necessary to see your gynecologist if you experience bleeding during or after intercourse, or bleeding after menopause, or periods closer together than 21 days from the first day of the one to the first day of the next bleeding episode. Gynecologists are not always able to determine the cause of menorrhagia, but it is important to rule out the potentially dangerous causes such as cancer. Some of the many conditions that can result in heavy menstrual bleeding include the following: hormonal imbalance and lack of ovulation, uterine fibroids, polyps, endometriosis, adenomyosis, certain medications, thyroid disease, pregnancy complications, bleeding disorders, pelvic inflammatory disease, and lastly, cancer. When you schedule an appointment at our gynecology clinic, we will ask you questions about your medical history, current medications, surgeries, pregnancies, and your menstrual history. You will also have a physical examination, and it is likely that you will have additional testing that might include laboratory workup to check for pregnancy, anemia, thyroid disease, clotting disorders, and or hormonal imbalance. We may also need to do a pap smear to look for precancerous or cancerous cells on the cervix. A vaginal ultrasound may be done to look for uterine fibroids, polyps, thickened uterine lining, ovarian cysts or masses, or pregnancy complications. We may also need to do a endometrial biopsy to assess the uterine lining for changes that can lead to cancer. We can also do hysteroscopy to look at the inside of the uterus and search for any cause of your prolonged heavy bleeding. Once the diagnostic testing is completed, the gynecologist will have a better understanding of what is causing your heavy menstrual bleeding. Then a plan can be made for how best to treat the problem. The treatment options will vary greatly depending on the diagnosis. Some possible treatment options include hormonal therapy with oral contraceptives, hormonal replacement therapy, or insertion of a coil. Thyroid medication may be necessary, anti-inflammatory medication, uterine fibroid embolization, hysteroscopy with DNC, that is dilatation and curettage, or fibroid dissection or polyp removal, endometrial ablation or cryoablation are other options. As previously mentioned, the most appropriate treatment plan cannot be determined without researching the cause of the bleeding. That can all be handled at our clinic. Visit us if you have any of these symptoms. For any gynecological or obstetric consultation, kindly visit us at any of our branch, either Westlands or along Gong Road. In Westlands, we are located in Krishna Center, 3rd floor, suite number E17. And along Gong Road, we are situated in Loyal Square, 6th floor, near Prestige Plaza. Thank you. Kindly do not forget to subscribe to our YouTube channel. You can also follow us on Facebook and Twitter, or visit our website and our blog to book appointments. Thank you.